this is a patient with history of breast cancer, and there's a CT had, complete response on prior imaging. So then the patient had a follow-up imaging, and there's, these new lesions here. So new lesions, of course, puts this patient as progression. So the patient underwent Eovist MR. So this is a Eovist hepatobiliary phase. We have in and post phase. Oh, excuse me. This is the portal venous in and post phase, and then Eovist hepatobiliary phase down in the right lower quadrant area. And so the patient has severe steatosis on the post phase imaging. There's signal dropout. And the teaching point here is when you look at the Eovist study, or there's like at least 7 lesions. One that it's really hard to see on the CT because of background steatosis. So the big one that we saw, but there's also small ones here. There's one here. There's probably one here. So the teaching point, Cookie sent me this case. She said, just sort of pitfall, and the pitfall is patients with breast cancer or colorectal cancer who have background steatosis. Our ability to detect metastases is limited, and so in these cases, they usually harbor many more metastases than what we can see on CT because of background steatosis, and so we should be recommending really MRI. With Eovist to really fully characterize the extent of metastatic disease in patients specifically with colorectal and breast cancer.
In your impression, would you say you would only kind of recommend hepatobiliary phase MRI if you also see a suggestion of steatosis on CT?
Yeah, and which is what Cookie was saying. So patients with background steatosis, we should recommend MRI.
And yeah, a lot of people are using it now also for melanoma, like the high-risk melanomas, because they think they can pick up more lesions on the Eovist hepatobiliary phase. Steve says, yes, and some anti-neoplastics cause fatty liver too, which, yeah, definitely, especially, patients on chemo for breast cancer, they're going to get a lot of fatty liver.
Yes, and the other thing that Cookie told me about, which I didn't know, was this condition called what did she say? POHL. That's post oxyplatin hepatic liver.
Blue liver.
Yeah. What?
Blue liver. Like sinusoidal obstruction syndrome caused by oxaliplatin and certain bone marrow transplant chemotherapies.
Yeah, exactly. So, I mean, and these patients, she says specifically like fulfari and oxaliplatins, chemo cause fatty liver and hepatic steatohepatitis. So, I mean, that's why, that's what leads to this fatty liver in many of these patients. And so we should really be recommending follow-up surveillance with MRI, not CT.
Yeah. I think the POHL, though, is the oxaliplatin related stuff is sinusoidal obstruction. So it actually is this patchy enhancement. It's not fat.
Heterogeneous.
Yeah. And then it's very hard to see on our imaging, but in the OR, I mean, it's basically a super congested liver. It's like a blue liver, they call it. And it makes it really hard to do hepatic resections. I can show a case of that next time.
Yeah, show a case of that. I didn't know that was an entity.
Gitanjali, do you have your stuff working?
Yes, I can try. Let's see if it works.
And David is saying that the chemotherapy-associated steatohepatitis is called CASH. Chemotherapy-associated steatohepatitis, CASH. Okay.
Can you all see my screen? I'll just leave